The study came about because, like I said, the incidence of colorectal cancer is rising in Nigeria. And as a clinician, I meet patients every day with colorectal cancer. In my clinic, what they ask me every day is that, Doctor, what have I done wrong? What have I eaten? What habits have I taken that is actually predisposing me to this cancer? Unfortunately, if you ask most of them, do they have family history of colorectal cancer? None. Do they smoke? None. Do they take alcohol? None. Most of the risk factors that are associated with colorectal cancer in most high income countries are relatively absent in our population. And that's what motivated us to look at how do we identify the risk factors that are important. Many people believe that colorectal cancer is related to diet. What has changed in our diet? Could it be environmental? And that's why we are doing a number of funded research. One of our research is looking at what are the modifiable risk factors. We are looking at the diet, we are looking at habits, be it smoking, be it alcohol intake. We are looking at, we are even quantifying the amount of food because we work with a number of food scientists that help us to quantify the amount of calorie that is being taken through pictures, validation, and all that. So we're running about 10, 15 pages of questionnaire to assess modifiable risk factors among our colorectal cancer patients. So we are recruiting about 600 colorectal cancer. We're about a fifth, about 500 currently, just about 100 to complete the study. And we are comparing that with 1,200 control. We'll reach 1,000 mark, just about 200 to complete the study. So when we finish this, we're going to evaluate what are the modifiable risk factors that our patient that have colorectal cancer has compared to the control. The way we select the control is that we try to match those control based on gender, based on the environmental they are coming, and some other factors that we can balance, that we can control for, so that at the end of the day, the control can exactly match up with the cases, and we'll be able to decipher what are the factors that need to be looked at to reduce the incidence of colorectal cancer. But more importantly, we are looking at the environment, because some of us believe that probably much has not changed in terms of our habits, but more has changed in terms of our environment because of industrialization, a lot of environmental film and the like. And we are doing with, funded by NIH, we have a wristband that we've distributed to some colorectal cancer and control in this study. So this wristband has the capacity of absorbing environmental pollutants that may be injurious to the health of the patient. So what we did was to give those wristbands to our patient to take home, and they wear it for about a week and bring it back, and then we send it to the lab. Hopefully in the next few months we'll have the result back, and we'll be able, from these two big studies, we'll be able to assess what has changed in our environment that may be injurious and fueling the increase of colorectal cancer in our environment. Two, we'll be able to identify what are the modifiable risk factors that are peculiar to our colorectal cancer patient, and subsequently be able to advise our community appropriately. It's an exciting day. Those data, I'm waiting eagerly to see those data coming out so that we can advise our people. And as a clinician, when my patient asks me next time, what have I done wrong? I'll be bold to tell them, this is what we have found, not following what is in the textbook that I know is not useful to them. I'll be able to tell them confidently, this is what we have found, and this is the advice that I have for you.